Hello Baltimore, it's Dr. Jeff Kalkstein with Drs. Adolf and Kalkstein Chiropractic, your Baltimore area chiropractic. And I have Deb with me, and I'll let Deb tell your story. First of all, how did you get referred to us?
Well, my goddaughter, Pam, gave your name to us, and my husband came to see you. He was really happy with results, and then I started having some hip pain, and it was radiating down to my knee and right up here near the groin. So I've had, what, 2 treatments, and I've already improved about 70%.
In 2 visits, yeah. How long were you having your pain before you came in to see us?
Probably about 2 weeks.
2 weeks.
It was strong enough, it was waking me up in the evening.
Were you having difficulty sleeping, lying on your hips?
Yes,
both
absolutely.
Hips?
Both hips.
Right.
And then I've had knee problems as well, and you surprised me.
But you didn't come for the knee, though, did you?
No, I did not, and I was really gun shy to let you touch it, and you said something about adjusting, and I was like, okay, and it really helped. It really helped.
Yes. And so the hip pain, it was daily?
Yes.
Constant?
Yes. And not only when I was sleeping and laying on my hips. The burning down here on the leg was constant.
So you even had some burning pain down the front of the leg?
Yes, yes.
So on a scale of 0 to 10, what was your pain level like?
I think it was as high as a 7, 8. Yes, 7, 8.
Well, enough to wake you up at night, right?
Yes, it was waking me up.
And then she also had some knee pain, right?
Yes.
So after the first visit, she felt really better, didn't you?
I did.
Yeah, and then she came back in again, and she wouldn't let me touch her knee the first time. And so what I'm going to do is I'm going to show you how I set her knee, and it's really a basic adjustment that not everybody does. It's a pretty sweet technique.
It was.
So, and I think what we're going to do after this is she's feeling so much better. With her permission, we're going to show her some core stabilization to strengthen her core, because we need that as a foundation. And then we're going to show her how to strengthen her glute muscles in order to protect her knee, and we're going to strengthen her quad. And I think if she does those types of activities, she'll have some really great results. So show us where your knee pain is, right?
Usually what happens is like this, and what'll happen is I'll be walking, it'll sort of give and then pop back in, and it's painful when it gives.
When it gives, yes. Yeah. So the analogy I use is really simple, and actually this is not a chiropractic manipulation, this is more of a bone setting technique. When the knee is in the proper position, it's really locked in there very nicely like that. But sometimes it just shifts out and gets just that sloppiness to it, that laxity to it, right? And when it gets like that sometimes, you irritate the nerves that around the knee, right? And so this technique is designed to take just that little bit of a joint play that's not as snug as it should be, and we sort of just set it back into place. And you know, it'll stay that way, and if we can strengthen the muscles around that, it'll be a really nice fix for you, right? And it's relatively non-invasive, very inexpensive to do, right?
Yeah. So and I was surprised it was not painful. Very surprised.
Yes. So you were really gun shy, even though your husband had great results, right?
Oh, I was gun shy, absolutely, especially with my knee.
Yeah. A doubting Thomas, maybe, right? Yeah. So the only thing I want the crowd to see is they'll have to. We'll do another video. Let's have you go on your tummy, face down. We're just going to set the knee, right?
Okay.
Right there. And lean right in there for me. And then all I want you to do is, once you get down there, I just want you to lift that bad knee side, the foot off the up near. Now set it back down again. So I'm just going to make it a little bit longer, make it more comfortable. There you go.
Yeah, and I need something under that.
Yep. So we're just going to support that a little bit, because if she puts it into extension, what I do is I go through what I call a dog and pony show. I have the patient hyperextend their knee, and then before I set their knee, and then what we do is we set the knee and we go through that same show, and the improvement is pretty remarkable, right? So I'll just lightly set this, right? There you go. And it's really a very straightforward technique. So if you're having knee pain, I tell you, it beats a cortisone shot, right? Okay, go ahead and stand up for me. All right. So Deb, anything else you want to say to those folks in Baltimore at all before we
Yes, if you're having hip or knee problems, this is the guy to come see. Absolutely. This
is actually the office to come to, right? Because Dr. Blake is with us, and Jonathan and Ashley and Heather. They do a marvelous job. It's a great experience, right?
It is. Yeah. It is. Yeah. I've been really happy.
Thank you, Baltimore. We'll see you soon.
Okay.